All right, so we're in practice session right now.
Okay.
So it's not streaming anything. And are you gonna introduce it without any screen sharing first? And then when it comes up, he'll share the PowerPoint? So are you just gonna introduce, like, just on the camera or who's introducing?
I'm not doing the introduction. Nancy's going to do the introduction. Yeah, she's the person that likes to get up and do things like that. I am not. So yeah, I don't know.
Practice session go okay?
Yeah. I obviously didn't send you the right information to get in. I sent you the registration link or something.
Okay.
Maybe that's what I did. I don't know. This is a good way to see the back of my hair.
Cute, looks good.
Yeah.
I'm wondering, I'd like to see what Marshall looks like here because I'm wondering if we're going to be like looking at his nose.
Well, Nancy's going to be first
Yeah.
and then him, so we may have to kind of adjust it between the two.
Okay. Is that better? Yep. I can see them.
We had the webcam on a tripod. Yeah. We hooked that up to the laptop and they just had it here so that it, yeah, so it wasn't like a full frontal view. It was more
Oh,
like
okay.
from the
That would be
side.
nice. Let me get.
That's just putting it in easy.
Did you color your hair? Did you color your hair? Oh, I just never wear it down. It's always. Look at the curls. Pretty.
I'm very blessed. I really just have to sleep in a towel and just say it, but it's really just too much canvas. It's pretty good.
Yeah.
Been talking it up around Herman.
I'm basically why you sent out the email.
Yes.
Yep. I've basically done like, see you in person or on Zoom.
Yes.
Those are your only two options.
That's it. You either be here or you, yeah. Yeah, because we want to continue doing this kind of stuff. So if we have a good turnout, then we can.
Zoom is a little bit laggy on this computer. So I will say, if you click something and it's not working right away, just give it a second. So like I'll click this, it's gonna take a minute, but it'll come up eventually. So don't just like tap, tap, tap. Just gotta be patient with it on here. Just a little bit. There we go.
And question and answer. Girls are going to sit here and monitor that come up.
Through Zoom, all the questions that come up through Zoom. Anything you can answer, but there will probably be a slew of questions at the end that we will share with you for you to answer. So Allie, might use your laptop to.
Yeah, I'll be here.
Yeah. Several people have told me they're doing Zoom. So.
Should have enough charge left on it.
So I
So
just
it's
wanted
just part of
to.
something that started more,
Yeah, for the supervisor committee.
Oh, sorry.
Information on collaborate on this thing with us talk about.
It'll come back up.
Basically training, diversity, equity, and inclusion. We've got a big push for that on campus right now, and we've got a president's council, committees and subcommittees and work groups and all of that. About having a panel of those people that are participating to come in and be able to answer questions, just to be more interactive and involved and ask good questions.
Maybe you click on you and then if I.
We still like our coffee breaks and stuff like that, but we like to do a little bit more. And she's gonna do the webcam on a tripod. So it's not, you don't have to adjust the laptop between Nancy and you. You have. So.
I only have one laptop in our office, and I don't know if Shannon did it.
Okay, here we go. Thank you.
Do we need to speak to the microphone or anything to see if it's also available? Cause I hear myself.
Because you're gonna want to mute yourself. Oh, I.
Okay, good.
Yeah, it's just because
I don't
Nancy
want to hear
joined.
myself. I just want to hear Mark. And Nancy. I don't have an excuse.
For some reason, the chat is up, so I'm able to get.
Well, maybe, depending on how far we
Yeah.
want to move it. The carpet. popped up.
There's some people don't.
I tried to load them.
There's a hunk in the floor over there. I'll trip on every time I walk over there. So.
Don't you buzz off.
That's good. That is good.
Kind of depressing, but on this stuff.
Not giving. Testing, testing, testing. Okay, cool. Just making sure. Great. Can you hear me okay, Tanya? Okay. All right, camera's good. How do we feel about this height? Yeah, let's.
In front of him or beside him? in on the screen?
Can I? Yeah.
Is that your good side?
I don't know. I don't know. I don't know my good side. It works.
That is the back of my head.
That's fine with me.
Mic and speaker are working. Yes. Okay.
Nancy Dobbs gonna be on the screen.
Once we start the webinar, put it in speaker view. It'll only be who's talking, obviously. So it should be good. All right.
First thing in the morning, she's like,
we
"Here's
have to-
something."
So just once it's 4, whenever you want to start, a few minutes before, just start webinar and then make sure it's in speaker view.
So to make sure it's in speaker view, that happens after we click start.
Actually,
Anything.
we can change it now. That's silly of me to say. We got it there.
Okay, so now it's just Nancy Dobbs showing.
Testing. Well, it's gonna come up here. I think it's just since. Yeah, so this is what a participant would see. Since you're the host, you're gonna see yourself. This is a big one. Or sorry, you're gonna see participants, yeah.
I'm a.
Right.
She's a co-host.
Let me
But this
show
is
you.
myself view.
I guess I'm wondering what's gonna show up on these. Because right now it's Nancy
Well,
Dobbs.
what's gonna show up on these is the PowerPoint,
Okay,
because that'll be
perfect.
shared. I'm gonna join as a participant. I can send an email.
Okay, while you're doing that.
I'm non-video.
Okay, you're still.
Oh, up there, yeah. True. Yes, my city's taking.
Right, I
guess I'm digging too.
Not that anybody's. Okay, so. Not video. Yay, I'm here. Yay. Hello. How are you? Yeah, sure did. I did something from that. Oh, yeah. Today's our anniversary. Oh, yeah. Hey. I'm going to a baseball game. That's right. Oh.
So, yeah, let me do a long prayer tarot spread right here for
Hey, you
mental
can
health.
read my tarot cards.
So good for my mental health.
You're going to do that with me sometime. I'm gonna experience.
See what I find. I've gotten to the point where it's a color code everything. Shakespeare person. And I pull a card. So whenever I have all my anxiety attacks or get stressed out.
Look at me.
I think I'm just rolling my eyes at you.
Like I have that, but not as defined, not as.
I don't have a top lip. It disappears. It's gone. Somebody with longer arms.
Longer arms.
It's my turn.
I'm shaking, make sure they're not worried.
Hello.
Hey, Dan.
Another in-person participant.
So we should be able to see our photos.
We've got 2 minutes.
But right now, it's just us. Yeah.
Oh, nobody has started the webinar yet. Maybe there's people.
Yeah.
Maybe there's people
They'll join.
waiting. I'm nervous.
I'm gonna start it from over here so that I'm not in the camera. Stopping video right now. All right, they're rolling in.
Good afternoon, everyone. My name is Nancy Dobbs, and on behalf of the Staff Advisory Committee, thank you so much for joining us. I think we can all agree that the past 17 months have introduced our daily lives to many new challenges accompanied by a variety of emotions. It is with that in mind that the Staff Advisory Committee and the Human Resources Department are pleased to have Marshall Jenkins here to talk to us about mental health, COVID, and a bit of the relationship between the two. In 1987, Marshall graduated from the University of North Carolina at Chapel Hill with a doctorate in counseling psychology. And that same year, he found his home for the next 33 years here as the rector of Barry's Counseling Center. After retiring from Barry in 2020, Marshall started a private practice here in Rome where he specializes in depressive and anxiety disorders, life transitions, grief, relationship challenges, and spiritual guidance. And now, without further ado, please join me in welcoming Dr. Marshall Jenkins.
If I move the speaker view, will that work? Will that mess things up for you all? Okay, I mean, I know how to do it. I just wanted to be sure I wasn't interrupting your system. There. Okay. Thank you so much, Staff Advisory Committee, for inviting me here. It was a very pleasant surprise to be invited back to Barry, and it's great to be here. I've missed you. I've missed so many people here and missed Barry College. I'm off to a new life and a new start, and it's going well, but I'll always love Barry and appreciate this opportunity to make some contribution if I can. I want to say before I start, congratulations. You've made history this year. We haven't had a pandemic since 1918. I'm not going to tell you the story of my uncle who was in college, or my great uncle who was in college then, but you've made it through this year, and I don't know the details. I have kept my eyes in another direction on purpose to guard my heart and to not meddle, but you made it, and whatever challenges you faced, congratulations for facing them during this bizarre year. I'm here to speak about COVID-19 and mental health. There's a lot to say about that. And I will pause in the middle, I think, and at the end for some Q&A, but we will just jump right into it. I want to give you, first of all, some terms that can help us put this in a frame so that you'll know what I'm talking about, because I'm not going to assume that you're a mental health professional. So a few ways that I understand things and frame things, and that many of us do in my profession, is first of all, how do I understand mental health? When we're talking about mental health, it's a good idea to be in touch with what we mean. And what I've written there is that it consists of a person's stress, resilience, and ability to love and work. Let's start with that second concept, the ability to love and work. Sigmund Freud said that. Someone said, Dr. Freud, you've shared with us so much about dysfunction. What's normal functioning about? And he said, the ability to love and work. And while very few of us in the mental health professions follow Dr. Freud as our guide in all things by any stretch, he said a few wise things, and that's one that people really hold on to a lot. It's about functioning, how well you function in your relationships as well as in the work that you do is a good, simple, clear, straightforward way of looking at mental health. How well do you function in those to major critical areas of your life. But I've also put in there stress resilience, because you could be functioning well in your marriage, in your work relationships, and so forth. You could be functioning just fine in your work, but you could be in a lot of pain emotionally. You could be feeling a sense of doom, low self-esteem, just an aching loneliness. All those things can be there even as you're functioning well, and that counts. That's distress. That's we count that with any illness as a factor for illness, and so it is with mental health too. Resilience, I like that word. It's, if you just imagine a rubber ball and you squeeze it and it returns to its original integrity, that's what it is, our ability to bounce back to our integrity from the stresses of life. And of course, the breakdown of that resilience and loss of functioning in love and work is what we would call mental disorder. So so think of it that way when we're talking about that. Protective factors is an important term. What are the things about a person's life, but both that they have inherently, even organically, but especially in terms of their habits and practices and lifestyle and their circumstances? There's so much there that protect us from breakdowns in our functioning, as well as in our resilience, everywhere from having a social support system to having adequate food and shelter to spiritual life, a good structure of your life, stable work, all those things. So much to say about what protective factors are. And that figures a lot into the way to think about COVID-19 and mental health. Therapeutic practices that includes psychotherapy, which I do every day, and so do Carly Price and Terry Cordell, but it's not just that. Anything that we do that helps us to build, to restore resilience and restore functioning, I'm referring to as a therapeutic practice. So that gives you a little bit on the terminology. Two critical questions to think about it, to have in the back of your mind as we think about COVID-19 and mental health. That first one kind of lists the critical conditions that come into play. How do conditions of isolation, threat of serious illness, low control over prevention and treatment of illness, and significant losses affect mental health? All those factors have been at play for this past 1 year plus for us. And so those have major impacts on mental health. And that's why we're having this conversation today. And there are a lot of conversations and programs around the country about it. Secondly, of course, what factors and practices prove protective and therapeutic under those conditions? So those are the two questions to keep in mind as we take this time together today to reflect on COVID-19 and mental health. Now, here's some of the data. As the pandemic was getting underway, the U.S. Census Bureau and the Household Pulse Survey formed the Household Pulse Survey to track mental health and related factors in America as we went through this. And so as you can see in this survey, 35.8% of the population reported anxiety symptoms, 28.4% depression symptoms, and the combined think Venn diagram, there's a large intersection set between the two, those reporting one or the other or both, and they're usually together for most people, 41.1%. That's a little over 2 out of every 5 people reporting symptoms of that. There's a survey that is very close to that in the way the questions are asked, similar sampling. The NHIS survey, just before the pandemic, the combined was 11%, according to that survey. So you see that mental health symptoms went up, mental disorder symptoms went up pretty significantly with the pandemic. Not surprising, I think, to most of us, but that's quite a magnitude of increase. Whose mental health was most affected? A study by Vinegard and Benros. Not many surprises here. COVID-19 patients, of course, a great deal of depressive symptoms, post-traumatic symptoms. And of course, those who already had mental disorders, those were exacerbated more, which we'll talk about again. Healthcare workers, I think we're all very much aware of the conditions that healthcare workers were under were very, very extreme, and their symptomatology went up. Looking at the general population, women, people reporting poor health, and people with family members with COVID-19. Now, why would you think women would be especially affected? I'll just kind of move along with women. Women tend to multitask more than men, and in the household, there's often a lot more of the children coming to mama for various support and needs and all that first. And so I think that may play into that. But so quite a burden on a lot of people. Not many surprises though in that slide. I think but that slide does leave out something huge. Just a few days ago, Dr. Fauci, whom we all know, was at Emory accepting an award, and in his speech he spoke a great deal about the undeniable effects of racism, and just to quote him, when he says, now very few of these comorbidities have racial determinants, he's talking about the biological factor. It doesn't, a lot of the problems, the health problems, mental health problems included, that come with COVID-19 have to do with what he calls social determinants that date back to, as he said, dating back to disadvantaged conditions that some people of color find themselves in from birth, regarding the availability of an adequate diet, access to health care, and the undeniable effects of racism in our society. I'm reminded, just as an example, there was a speaker here at Berry a few years ago. I don't remember his name. I've moved since then, I think, and I couldn't find the book. but I read the book. But that's that African-American gentleman who was the urban farmer. Do you remember the urban farmer? I remember his book was very, very informative about a lot of factors that privileged white folks like me just miss. And one of the things that he pointed out, I remember in that book, was that access to grocery stores with quality food for minority people of color who are often in lower income areas, those grocery stores are far away, and access to that quality food is so much more difficult. When you're under those conditions, obesity is going to be much more of a problem. You're eating food that's going to contribute to that kind of problem. And what's one of the risk factors for serious symptoms from COVID-19 or death? Obesity. So that's just one example. And these are the kinds of things that minority populations have had to deal with. And so little wonder that we've also had in the news a great deal of outcry for justice in these areas. It's really exposed it. Now, that carries over into mental health concerns. And this is from the CDC back in June. You see not much difference between just comparing white and black, Caucasian and African American, if you will, populations. Anxiety, not much difference, maybe a little bit more with the white population. But as we move down this list, we get larger and larger discrepancies in terms of some very important mental disorder symptoms. We have a noticeably larger report of depression symptoms in the black population. That COVID TRSC, let me translate, that's trauma-related stress checklist as measured by that checklist, more trauma symptomatology among Black people. And let me just say this too, when we think of trauma and we look at the classic way of looking at PTSD, we're usually thinking about a horrible event that happened. But trauma-related symptoms can also result from the chronic stress of being invalidated, of being treated as inferior, of coming to think of oneself as inferior, of being followed by the police at times when I wouldn't be, you know, and things like that. Those things can start playing out in trauma symptomatology, and the pandemic conditions exacerbated that. Drug increase, that's going from zero to use of drugs, or use of drugs to more severe use of drugs in order to cope. Definitely there in the white population, but much more marked in the Black American population. Suicidal thoughts almost double Black. And then that greater than one, I've got MI, I wish I'd have said MD, mental disorder symptom. Noticeably greater in the Black population. Not surprising, really, when you look at the inequities that African American people have long had to deal with, but that were had a hot spotlight shown on them and became much more severe with the pandemic and the adjustments we had to make. Now, this is just a little bibliographic note. Much of what is to follow is from the American Psychological Association's Stress in America survey, the most recent rendition of that. And not that you have time to write it down, but there's the there's the URL. You can find it pretty easily online, and there's a good summary page that I draw a lot on from this. And just to kind of continue on the theme for another moment. One of the significant findings was that Black Americans were more likely to feel concerned about the future. That's worry. The hallmark of generalized anxiety disorder is worry. And if in other words, it's saying that there's more worry in the African American population, and the worry about adjusting after we return back. Well, there is no back to normal. Okay, excuse me. But as we transition out of the pandemic conditions that we've been in, that's across the board. That's all of us are struggling with that. Okay, but it is more pronounced with minority populations there. By the way, the data on Native Americans is rather sparse, but what data is there suggests that a lot of this is quite possibly worse in Native American populations. Not surprisingly, because their conditions are pretty extreme as well. Essential workers, again, the race issue touches on this, because so many there is such an overrepresentation of minority populations among essential workers. And not surprising to any of us, they were much more likely to seek mental health services, which it's at least good that seeking mental health services is what we find there. That's a positive thing. And thanks to teletherapy, I think mental health services have in some ways been more accessible. It really helped me to kick off my private practice to be able to do that. But also just the diagnosis of essential workers really went up. This is not surprising to any of us, of course. Now, to poke a little fun at myself, the reason you see the bullet points Gen Z, Millennials, Gen X, Boomers 2, and Boomers 1 is because I have a hard time keeping up with these groupings and what years they are and all that. So I put that down there. But you see this, the point is really very simple and very stark and very, very relevant to a college like Berry. And that is, the younger you are, the more reports of mental health worsening during the pandemic. Just kind of going down the list. From Gen Z, it's at 46%. and on down, but especially Gen Z, I think. Those of us having been in the college counseling world most of my life, and those Terry and Teresa and Carly who are in it, can tell you that the college student mental health concerns have been on the rise for decades. It's been going on and on and on up. I started in college counseling 40 years ago. It's a different world than it was 40 years ago. Now, we dealt with a lot of distress and had to deal with emergencies. Don't get me wrong, but it's become a much more complex, severe picture for the average client in college counseling. And so it doesn't surprise me too much from that perspective to see this number. It's a situation that was already pretty significant and is exacerbated by the pandemic. Parenting. How many folks that I have been meeting with online who had to stop for a minute and attend to a child and so forth. People who's, who are doing their work from home and whose children are doing online school. This has been very stressful for a lot of people. I think of that as being probably, a factor in the women that were in the study I cited earlier, being a population with special levels of stress. But I do have to tell you, I have, on my own caseload, I've been struck with how many men I've been meeting with whose wives have been working out of the home more, and they are professionals with churches or law practices or things like that to deal with, and taking care of the kids too. That's one of the main factors, and of course, just the natural worry about your child's safety and health, and all that undoubtedly playing in as well. Now, sleep. Now, those of us who in the mental health world, but you don't have to be there to know it. If you're one of the main protective factors for mental health is, are you getting enough sleep, right? So, as 2/3 of Americans said they're sleeping more or less, both of which can be problematic. That's also that's not just a cause, of course, of mental disorders or loss of stress resilience, to be specific. It's also a symptom picture for depression. Folks who are depressed often, their sleep patterns get out of whack. Difficulty sleeping through the night, or sleeping too much and difficulty getting up. So it may be an indirect picture of that as well. Self-medicating, that's a mental health term for drinking too much alcohol or using drugs to deal with stress. It's okay at the end of the day to go home and have a glass of wine with your dinner just to unwind after a day at Berry College, but it is a concern when someone says, gosh, I'm under a lot of stress, it's time to have a drink. That doesn't mean you're addicted, but it's on the checklist. If you're doing an assessment and someone tends to say, okay, I'm under stress, I better drink, I better change my mental state due to that. More of that has been going on with it during the pandemic. Weight change. This one has the numbers that I'm not quite sure I completely believe yet myself. I have to work on this one a little bit. But a majority of adults reported experiencing undesired weight changes. Not really a surprise. And about 42% saying they gained more weight than they expected. Of that group, the median weight gain was 15 pounds. This is the part where I had to say, really? But the average was 29 pounds, which would suggest that, okay, there was a lot of people who gained weight, but on the upper end, there was massive weight gain. So if the median's 15 and you've taken the average up to 29%, there was a lot of weight gain related to that. Like sleep, that's kind of a cause and effect. If you're having significant weight gain, that can really affect your self-esteem in a negative way. Sometimes weight loss can do that, but for most people, weight gain. But it's also a symptom picture with depression to have significant weight loss or gain. Utilizing healthcare services, and it's not surprising, a lot of folks canceled healthcare services. Sometimes that's like me postponing my dental checkup, but I also have heard a number of reports of people with some pretty significant health issues who are putting them off, putting themselves a little more at risk and accepting that risk, but under stress for it. So those are some of those factors. So I want to pause here for a minute. I've been talking fast. I've been giving you a lot of information. Before we get into a few of my thoughts, walking a little bit past the data to some of my thoughts that I want to share with you. I want to hear your thoughts. Any thoughts or questions based on what I've been sharing, or about your experience, or insights that you would like to share, either from the folks here in front of me or the audience online. Any thoughts or questions at this point? Okay, well, I'll just plow forward then. There will be another chance. Okay. To me, as I look at the data and look at my clinical experience, I think a key phrase here is pre-existing conditions exacerbated. So much of what the pandemic did from a mental health perspective is it took took conditions that were already difficult for certain populations and made them worse. That's a lot of what we see. That's a theme that I think cuts through the information and the experience pretty well. As discussed at some length for racial minorities, the inequities that cause stress already in that among racial minorities were only brought out more and exacerbated by pandemic conditions and adjustments. Among the elderly, loneliness already a factor. I know in talking with my older parents, they would often say, well, we're doing okay. So our friends are dying though, things like that. There would be, there is loneliness in that group. And now it's just my mom I call, and she's 96 and she's spent most of the last year by herself. And that's tough. That's tough on cognitive functioning. That's tough on the heart. That's tough, and it's been hard for many of us to face that and be with that. The middle years, so much worry about money and trying to develop financial security to take care of families and take care of ourselves after we retire. Of course, there's been some real threats to our finances, and for many of us, some losses with the pandemic. And as I've mentioned earlier, the multitasking that we tend to do in middle years, which stresses already, was only increased. Young people, I put attention deficits and despair. I'm not just talking about attention deficit disorder. I'm just talking about what this has done to us in America. And that population, it's really affected all of us in significant ways. But one of the things that we've seen in college counseling for so many years is that this does kind of wear away at coping abilities to just deal with the normal boredom of life, as well as to sustain focus in relationships and so forth. And this has made it only worse. There's been a lot of leaning on that. And it also often for many young people costs them their sleep. Despair, maybe that may sound like a strong term, but I think that's a lot. Just the sense that the future is not, that there's, I compare my life, I think my category was boomer 2. I compare my life to young people today. it was scary, graduating from college and having a future in front of me that I was going to have to navigate. But boy, the maps were so much better back then. It's tough for a lot of young people to muster up hope and to really know where they're going with their lives. So those factors. Now look what's happened to the world. This is unpredictable. We're all kind of in a liminal zone here, trying to figure out our lives, and I think that's really affected young people a great deal. Just putting the focus more on isolation. Why does it hurt? I think we all know that it does. But just some thoughts that I've had about that over the course of the last year in my work and in my life. We have a fundamental need for attachment. And classic research in psychology with not only human beings, but monkeys, primates, we know that when, for instance, when you separate the baby from the mama and you don't have the kind of stimulation and interaction, that has long-term deleterious psychological effects. But it doesn't just end with infancy. We have those needs for the rest of our lives. The needs change, and maybe the frequency and intensity of the kind of stimulation, the need for that changes, but we all need attachment, and we all have attachment styles. And for all of us, the pandemic put us under lots of challenges as far as sustaining the kind of normal attachment that we sometimes take for granted, that stabilizes our lives. Looking a little bit more in the details of that lack of mirroring, that's a shrink's way of saying, lack of having someone to kind of resonate with you, empathize with you, validate you. We all need that. It's not that it's not there, and it's not that you can't get some of that online, but I think there's it's gone down, and that affects people. And where I put cognitive feedback, keeping a perspective in life, we get misled by other people a lot, but we probably get more validation that we take for granted every day, and information that helps us to sharpen our view of things and keep from going down delusional paths every day, just in normal everyday interactions. And I think the reduction of that, and the reduction of that, plus the increase of social media exposure, which is often very distorted and very misleading about reality, has made our reality contact perhaps a little bit more shaky. The starving extroversion. When all this started, and I was not leaving my driveway to drive to Berry, and we were all staying home for a while there, and the roads were empty and all that. One of my first thoughts were, oh, what about the extroverts? What are they going to do? See, now I'm an introvert. It's pretty extreme, actually. And but I thought about the extroverts, and then the old Myers-Briggs kind of way of thinking, whatever you think of that, I think there's something to the idea that some people get their energy from interacting. Most people get their energy from interacting with other people a lot. Others, like myself, we charge our batteries better by ourselves, and I think that's just common sense, everyday contact with people. I feel like I see that a lot. I worried about my extroverted friends and clients, and indeed, I think the experience did bear it out. Some people I was talking to, some people have just had to work through. I'm used to being with people. I'm used to touch. I'm used to conversation. I'm used to interaction. I have a fairly large number of, not a majority, but I have a number of pastors who are on my caseload. Boy, that pain among pastors was great. Of course, it also interacted with how do we do church during a pandemic, which was significant too. But I think there's been a lot of pain out there from that. And then loss of social purpose. And this one especially makes me think of the Gen Z, the college students, the young adults. We don't only benefit from social support, we benefit from supporting. We find when you ask folks about meaning in their lives, most of them couch their answer, not all the time necessarily, but most folks couch their answer in relationships and making a positive impact in the life of others, whether it's making things for others or listening to others or just, cooking for others, whatever we do for other people that gives us a large sense of our meaning. And college students or young adults are at a time in their lives when that's a hot issue. Again, like attachment, it's always an issue throughout our lives, but it's a hot issue. They're formulating that, they're launching, okay, on a meaningful life that's usually in that context. We have a pandemic, we have to stay home, that what are we going to do? What's this going to mean? That's a jolting interruption for all of us, and I think especially of college student age folks. Finally, some silver linings that I've observed, just to share with you from my perspective. I think it's kind of encouraging to see a lot of folks shift their priorities from achieve. That's a hard thing to say at a college like Berry College, but I think as far as I think when you really look at the whole human wholeness, we can overemphasize that in America, and especially at places like this, we certainly do overemphasize that. And the pandemic has, I think, for a lot of folks, sometimes in painful ways, like in the case of being separated from my mom in the assisted living facility, but also in positive ways, being at home more with the family. I know my stepson a lot better now, from his having lived with us for the last year. It shifts our priorities from achievement more to community. And I think that may be a silver lining that we find from all this. It's good for mental health. So much of mental health has to do with how connected we feel in our lives. This is one that embracing solitude as a source of spiritual growth. Some of you who know me know that my work as a psychologist is more of an extension of my spirituality than spirituality, something that I add onto that's very central to me. And so I have to reflect on it in those terms too. And when I think about great spiritual writers like Thomas Merton and so forth, who I draw from a lot, solitude is a very positive thing in spiritual traditions. And solitude is not about being disconnected. And it's about going to be alone in order to grow in love for God, for the world. In Buddhist traditions, they wouldn't put it that way, but they would put it in terms of experiencing yourself as part of the interconnectedness of all things, perhaps. But it's finding in your heart and within yourself that common ground and a love for the others, even the transcendent other. And I think I did see some data that suggested that more people are practicing more spiritual practices during the pandemic. And I think that can be, we can take this being a lone thing and we can turn it into something really positive if we come at it from that perspective. Meaningful interactions online. Yes, I would rather be face-to-face with people, but I certainly can say for myself that, my eyes are numb at the end of the day, but it certainly has been good to be able to connect with people that I would not have otherwise been able to connect with. I'm not just talking about therapists. I think I'm talking about all of us. But to speak a little bit personally, I'll just never forget, about 3/4 of us therapists thought this wasn't going to work. It's worked pretty well. I'll never forget the first time that I was working with a client online who I'd only known online who had a breakthrough. And I thought, that's not supposed to happen online. But it did, and it's happened many times. And so we now have a tool. Most of the people at this talk are online. So I miss you. I'd like to see your faces, but it's great to have you here. And so it has given us that. And then finally, that final thought, remapping the route. It's disrupted a lot of lives. But sometimes in that disruption, oftentimes in that disruption, it's an opportunity to step out of the groove that you're in and say, okay, well, what about these aspects of my life that I've been forgetting? Or maybe I need to rethink my direction a little bit. And that can be a very positive thing for a lot of people. I think, I suspect, like I said, I haven't been watching very, very closely, but I suspect that there will be some sense of, that there will be some, you'll see some folks return who are older and wiser, who have more direction to their lives. Let's hope so. Maybe I'm being optimistic, but I feel like I've seen that in a few folks I know, including myself. Okay, now I put down the question, what silver linings have you found? I made a grammatical error on my PowerPoint, but have you found during the pandemic? And I would be interested in any answers you have to that question, or I understand that there's the possibility of other questions with which I will do my best if they come forward. So any questions along those specific lines of silver linings, or any questions otherwise, or points?
We had one question. What would you suggest a parent concentrate on when looking for a therapist for their child?
Right on when looking for a therapist for their child. I think that when we're thinking about child therapy, it's very different than therapy with adults, in that with the child, the patient is just as much, if not more so, the parent as the child. In other words, the parent is such a constant presence and such an important attachment presence in the child's life, and this is all live and in color. Whereas those of us who've graduate, who've gone on and are in adulthood, we're mostly working with memories. This is live. This is happening now, and I think that in looking for a child therapist, it's important to find someone who is going to work effectively with the parents as well as the child. But one of the tricky things about child therapy, though, is that the child needs to feel, especially the adolescent child, needs to feel that there's some privacy in there with them, and so it can be a really tricky balancing act. Check with these folks. Be sure, talk about those kinds of issues with the child therapist. About helping the child to feel safe with their privacy, but at the same time, how are we going to connect with each other and work with us as parents? Those are some of my thoughts about seeking out a child therapist. Yes.
I work in athletics, and I think, as you pointed out, we found lots of creative ways for our students. But what would you suggest with unpacking so much with isolation, the social purpose, things that being on a team, especially being a college student, but being part of an athletics team is really hard for athletes. It's a lot. We got back to a little bit, but like, we missed out on a lot this year.
Yeah.
About getting back to, or things that we can do to gain back that social purpose, or giving them what they need
Okay, so the teams, and again, like I said, I haven't been watching closely. I've been guarding my heart and all that by looking in other directions. So a lot of the team sports have not been, they haven't been together.
competitions in the fall. They were able to
Okay.
practice. There was a great team for the so it was very much a
Yeah.
controlled environment of how we do things, how separate we were. And then we did play in the spring. It was very, very different than a normal year. So especially seniors last year, it was just an odd year. A lot
Yeah.
of policies in place, not a lot of normal activities, and we weren't free to do. There was a lot of pressure on are not able to make it through season, or if you're not being safe, or if you're like doing activity, a normal college student.
A lot more restrictions in order to keep the team safe.
Yeah.
Yeah, yeah. And so what you're seeing as a result of that, you know, is a loss of cohesion on the team, or what are the results that you're seeing that are,
Yeah, I think especially in the fall, more so like separation.
okay,
But yeah, like, together, so probably a lack of cohesion and a lack of being able to do stuff together outside of practice.
okay,
Around the homes or
okay.
maybe what are some practices that we need to be trying to hone in on
When it's safe to do things. Okay, okay. To try to get them kind of reconnected, to become a team again, and to really have fun. Yeah. That's a great question. And often when the speaker says that's a great question, that means there's a, huh, let me think. But that is a good question. Beyond, you know, I guess the kind of getting back to the normal, I think there is obviously with any team, just getting back to the normal tasks of, you know, learning, doing plays together and learning, drilling together and all that kind of stuff is a lot of it's going to work out naturally that way. But you know, I think, I don't know if it would make sense for when it's safe to kind of go out of your way to have some additional, I guess, social events for the teams to reconnect. Yeah, yeah, yeah. Certainly, yeah. Certainly, when it's safe to do so, kind of getting just getting back into the routine and listening. If I were a coach, you know, really listening to the players, to kind of see what issues each of them are bringing back into the situation. That, like I said, I think the natural course of things with an athletic team really has a lot of the bonding and team building built in. So I don't know that you need to do a lot extra with that, but it certainly is a situation that might call for some more, for personal one-on-one kind of, hey, how's it been going? How's this been for you? Kind of reconnecting, which my impression has always been that from, at least for most of the teams, that's a real strength at Berry. I would be optimistic about Berry facing that challenge. Yeah.
So one thing I know a lot of athletic groups get involved in is kind of volunteering and helping, you know, those less fortunate. If that's something you guys could get back into, that might sort of be, it just always helps people to feel like they're doing something kind of more purposeful and beyond themselves, you know, to help somebody else. I wonder if that would be something they could do.
Getting that sense of purpose back in there. Yeah, great idea. Okay. Yes, sir.
The first bullet point to shift in priorities, agree with, but when you have students in your household, they lose some of that, I won't say pressure of achievement.
Yeah, yeah.
So it's a silver lining, but there's also a negative concept.
Yeah, yeah, yeah.
So not really a question,
Just a statement that in some cases it can be a worry that they've gotten away from, and that I've definitely seen college students. Well, last summer, I probably did more counseling because then I did more counseling than I'd ever done in the summer at Berry because I could counsel them from, Valdosta. We'd never done that before. And so I had a pretty good caseload, and I was working with a lot of folks. And I have a few college students now, but that I've definitely seen a polarization with that. There are some who really go adrift big time without having the contact in the college. And there's some who really get, this is what works for them. So yeah, I hear you. Any other questions or comments or insights? Okay. Okay. Well, thank you very much for inviting me. There's my information. There's my advertisement. I retired from Berry in order to work harder for myself, and so that's some information on how to reach me. Most of my practice is still teletherapy right now, but I'm segueing into face-to-face with fully unionized folks more. And I think psychotherapy will always, hopefully there will always be a good option for teletherapy with that. But in any case, that's how to reach me. For those of you who are here, I have my card, and I will be hanging around for a little while afterward for anyone who would like to come up and ask me that question or give me that feedback that you didn't want to do before the camera stopped. Okay. Thank you so much for having me here.
Marshall, thank you so much. I want to maybe just give us a closing couple of minutes to see if anyone online has any questions or whatnot. You asked about the extroverts. I don't know about everyone else. I can speak for myself as being a ENFP. The struggle is real. But, like you said, just with that priority shift and whatnot, there was other ways to be loud and put in energy out there. Looks like no one online has anything. Well, thank you all for joining us. In closing, I just want to close out with a quote by Mr. Fred Rogers. Anything that's human is mentionable, and anything that is mentionable can be more manageable. When we can talk about our feelings, they become less overwhelming, less upsetting, and less scary. So in the true Berry fashion, let's continue to strengthen and nurture our head and our hearts so we can better serve with our hands. And thank you all for joining us today.